Hey guys, Dr. Morse, Injury Experts. Unfortunately, we just saw a significant confirmation of Damian Lillard unfortunately tearing his left Achilles tendon last night. We saw when he was reaching out initially for the ball, you could see based on the angle of the video, if you happen to catch that view, you could see a little bit of reverberation in that calf and distal Achilles tendon. And that is very classic for Achilles tendon tear. You then saw him attempt to get up, obviously needed to be helped off the court, and significantly in pain, and immediately grabbing that Achilles, which is pretty classic. So this traditionally gets injured at what we call the watershed area, which is about 2 finger breadths up from the where it attaches to the heel. This is a significant area of poor blood supply. You have blood supply coming from up underneath, you have blood supply coming down, and there's a gap that it just does not, unfortunately, lead to regenerative healing in that area. So it starts to fray. Think of it as a rope. You have one fray this way, one fraying this way, and they actually come up and cross. What can happen is they start to fray, and then eventually they will full thickness tear. If he put an ultrasound on this tendon yesterday morning, you would have saw significant tendinopathy, significant thickness in that tendon. I've seen tendons that are supposed to be this big, and on ultrasound they are this big. They're ginormous. They're at very, very high risk for tear. So I don't know why that wasn't done. I don't know why this wasn't prevented, but unfortunately this is the situation we're dealing with. The other part that I wanted to mention here is he had a blood clot in his right leg, I believe it was, about 5 weeks ago, somewhere around there. And the traditional protocol for that is being on blood thinners for 3 months. Now, I don't know exactly how he was able to clear that protocol in 3 weeks, maybe closer to 4 weeks, but whatever it was, they cleared it. They allowed him to come back. Is there a possibility that because that was in his right leg, maybe he was pushing more off his left leg, causing more stress on that leg, causing that Achilles tendon to tear? Maybe. But this is more of a chronic wear and tear injury, even at these guys' age, than it is just a more of a freak thing. But in general, just really unfortunate because these are such a significant injury. We've seen it with Kevin Durant. We've seen it back in the day with Kobe. May he rest in peace. But they're just so important for basketball players, for that push, for that jump. It's very difficult to come back. Obviously, you can come back, but it usually takes at least 9 to 12 months, realistically, probably closer to a year and a half. So I would not be surprised if he missed the majority of 25, the end of the 25, beginning of the 26 season, and then probably all, if not all, of the 26 season. So maybe he returns in 27, maybe catches a smidge of about a year from now, just depending on how he's rehabbing. I would, he's probably going to have what we call speed bridge technique, which basically means that they're going to sew everything together, reinforce it, and then bring it together. You could do an old school PARS technique, depending on who's doing the surgery. And then I would not be surprised if they went in and reinforced it with some stem cells, after he's already been surgically cleared. But this is a tough injury and a tough timing, unfortunately, because now they're going to have to try to make a run through the playoffs without him. Wish him the best of luck. Hopefully that was clear. I'm Dr. Jesse Morse, a sports medicine physician from Miami.